a disease that slowly paralyzes you when left untreated, a disease that restricts your daily life and cannot be healed in this moment of time, a disease where our own body damages us. In today's podcast, we'll be talking about multiple sclerosis. If you've never heard of that, that's no problem, because we have an expert here today, or I would like to say 2 experts. So with us today is Dr. Ineichen and his teddy bear. Thank you very much. Thank you for being here.
Good.
So,
thank you for having us.
Thank you. So, how did your academic career start?
My academic career.
Yeah.
So, it actually started during medical school. I studied medicine at the University of Zurich. And my mother got diagnosed with multiple sclerosis when I was in medical school. And I was very young and idealistic, and this prompted me to actually take up an academic career in research, and I wanted to develop a new treatment for multiple sclerosis. I was young, and so after med school I went to a PhD program, an MD PhD program, and I dedicated 4 years of my life for research and aiming with the goal of developing a new treatment for multiple sclerosis. Mm-hmm. Although that was a bit naive, of course.
Yes, that's really interesting. And but out of your today's perspective, what would you say is the end goal of your career, even if it is a little bit far away?
Yes, the end goal of my career. Honestly, this is a brilliant question. I think we all should ask ourselves this question more common. And I mean, it's a very difficult answer, and I guess it's I mean, there's different aspects, and one of the aspects is certainly, so one of the things which I'm very much interested in today is understanding how imaging, neuroimaging, contributes to better understanding of multiple sclerosis, of the pathology, what is happening in the tissue. Mm-hmm. And MRI, so magnetic resonance imaging, is a very strong tool of visualizing multiple sclerosis, but it has a very low specificity. Mm-hmm. So it doesn't help us to understand what is happening in the tissue. And one of the goals, at least of the technical goals I have in my career, is to understand how can we make MRI more specific to really have a better understanding of what is actually happening in the tissue. That would enable then personalized therapy, for example, for multiple sclerosis patients.
Mm-hmm. You said that your mother unfortunately developed multiple sclerosis. Was it the only deciding factor in your career to go into research, or did you always know, yeah, I'm a researcher, I want to be able to do something in that way?
Yeah, it's a very good question. It was not the only deciding factor, and the research I'm interested today is not only multiple sclerosis, but there's another big topic which I'm very much interested in, which is animal welfare and the improvement of experimental conditions for animals. So that was just a start, and I would say there were other factors which were very important for me. I was always interested in research, I would say. But it was a process of admitting to myself that probably being a medical doctor I'd rather be a researcher than being a medical doctor, because you go through med school 6 years and you think, okay, I have to be a medical doctor now, but actually I realized that I think my skills are better served when I'm a researcher. Mm-hmm. I think that also was a big step for me to have this insight and to really give up my medical career.
What was the factor what was the experience that really made you think, oh, I'm a better researcher than I would be as a doctor? I mean, that probably was a big jump or a big conclusion, because to all of us as medical students, we want to be a surgeon, we want to help people directly, with research you also help people directly, but it's not with the big connection, right? Yeah. So was there any particular experience that you said, okay, no, I'm a better researcher?
Yeah, so I mean, it was a process, and I think it's every one of us has to find their potentials and what brings them joy, and for me, I just realized that it gives me an immense joy of teaching, of giving lectures, and mentorship, like mentoring young students, and also chasing like questions of interest, relevance to a public audience. And being at the forefront of how knowledge is created, and I mean, I figured this out over time. There was not like one particular moment when I had this epiphany, but there was actually one moment where I was a neuroradiology, a medical doctor in neuroradiology, and they applied for research funding, so a big research grant, 1 million francs, and so. And I was very lucky, so I got this grant. So you have to apply, and others. It's very competitive, this process, and I was lucky, and I got the grant. And so I had to take this decision: should I give up my medical career, not finishing my specialization and going to research? Despite I like very much clinical medicine, neuroradiology is a very fascinating field. But it took me like 3 seconds to decide. So I heard about the decision of this grant: either finish your medical career and don't take the grant, or go to take the grant and do research. And it was very clear for me, like do research, that's my thing.
So now we talked about your career, and now I want to come to another topic, to the main topic of this podcast, multiple sclerosis. So could you explain to our audience maybe what is multiple sclerosis, what is happening in your body?
Yes, so it's a chronic brain disease, a central nervous system disease, brain and spinal cord. And most people would agree that it is an autoimmune disease. So your own immune system attacks parts of your nervous system, of your central nervous system. And that explains like all the subsequent things which happen then.
So the autoimmune system attacks your own body when you get the disease. What are the first signs then?
The clinical signs?
Yes, the clinical signs.
So multiple sclerosis is considered to be a chameleon. It can present in many different ways, and this is always a bit difficult because any non-specific symptom could potentially be multiple sclerosis. Although there are some common initial presentations, like an inflammation of the optic nerve, for example, is a very common first sign. Then you might have some pain in your eyes and your vision is decreasing. That's a very common first sign. Other signs which are very unspecific, and I know saying that is always a bit dangerous, because then people see, oh, I have a bit of paresthesia in my hand, you know, it feels a bit weird, it's tingling, oh, is this multiple sclerosis? So that can be multiple sclerosis, but of course it can have many other reasons as well. But that can also be a sign of multiple sclerosis, like a muscle weakness or a tingling in your arm or somewhere in your body.
And how do you differ those signs? How can you say, okay, that is possible multiple sclerosis, or it is for sure that, or how can you differ that?
Yeah. So a thorough clinical exam, taking a thorough history of the person, and then potentially, depending on these two things, potentially also a brain MRI or so. But that depends on what you see in the examination and the history.
So what is the incidence of multiple sclerosis in the population? It's not that high, right?
The incidence is, I think, 5 to 6 per 100,000 in Switzerland, at least. Yeah, it's not a very common disease, but what is important about this disease, it affects young people. So you are actually in the prime age of contracting multiple sclerosis.
Nice.
Although women are three times as likely affected. But so it affects like young people in their most productive times of their lives, and you have it for the rest of your life. So even if it's rare, it has still quite an impact on someone's life and on society in general.
Yeah. So how does a standard progression of this disease of multiple sclerosis look like?
In most cases, it will start with the relapsing clinical phenotype. So you have these clinical relapses where you have symptoms like some parts of a muscle weakness in some parts of your body, or my mother, for example, she had a half-sided body weakness for a couple of weeks. And usually from these relapses, you show a complete recovery. So you go back to full function after a relapse, a couple of weeks usually. And then you have this relapsing disease stage where you have these relapses very individually. Some people have very common relapses, some people have rare relapses. And this is the relapsing remitting stage. And at some point, some people, we still don't know why that is, but some people go into a progressive disease stage where the neurological disability is progressively increasing. There is potentially overlap by relapses, but the functioning of the affected person is increasingly like worsening over time. Mm-hmm. This is the progressive disease stage. Yeah.
You also mentioned at the beginning that the disease affects the nervous system. Mm-hmm. But what exactly happens there?
That's an excellent question. So many things are still not understood today. But one of the things, or historically, it's actually quite fascinating. Historically, it has been believed that it is primarily a disease of the white matter. So initially, people thought that immune cells attack the myelin sheaths of the central nervous system. So oligodendrocytes and the myelin sheath, they create around axons. And I'm sure you know the myelin sheaths, they are responsible for the efficient exchange of information between different nerve cells. And this myelin sheath is destroyed in multiple sclerosis. And people thought initially that this is the main problem. But actually nowadays, or since a couple of years already, we know that the damage is not specific to myelin. So these immune cells don't just damage myelin, but in the process they also damage the nerve cells, the neurons. Mm-hmm. And as you know, it's very difficult. This is like one of the big dreams of neuroscience, to regenerate neurons. Mm-hmm. And this is still, we are not there yet, and it's still far. I think it's a far away goal. And that's actually the main problem, that these nerve cells get destroyed and they cannot be regenerated. And we think that this is in part the reason why patients get worse over time with this progressive disease stage.
Mm-hmm. So it's a terrible disease. What are the biggest risk factors for multiple sclerosis? Yeah.
So being a woman is obviously like a significant risk factor. You cannot do much about this. Then what the biggest risk factor is actually is EBV infection, so Epstein-Barr virus infection. Did you have kissing disease actually?
No, no.
Do you know what that is?
No.
Pfeiffer's-Drüsen fever? You didn't have it?
No.
Yeah.
No.
But I've heard it, but not in the lectures. But I know Pfeiffer's Drüsen fever.
If you were in his lecture, you would have noticed.
Maybe.
But you might know people who've had it, right?
Yeah, I know somebody.
And this is actually a symptomatic infection by Epstein-Barr virus. Mm-hmm. Most people will have a subclinical infection, so they just get infected but have no symptoms at all. And actually it's interesting that when you have this clinical manifestation with this kissing disease, your risk is also increasing like significantly. Mm-hmm. But by today, so Epstein-Barr virus is actually like the most important risk factor, because as of today, no single MS patient has been discovered who has not been positive for Epstein-Barr virus. So this is like the most risk factor, most important one. And then smoking is also an important risk factor, and genetics is also playing in, and there's a couple of other things.
Mm-hmm. I always ask myself, does your mindset have an influence on the progression of multiple sclerosis? I mean, you hear always of people with cancer who are very optimistic that they have a better chance to survive cancer. Is there a similarity between mindset and a healthy progression or not?
I think the mindset always plays into how diseases affect you very much. I actually don't know. Do you know the evidence for cancer?
I don't know particular numbers. I also never checked it, to be fair. Yeah. But I always hear, if you have a good mindset and are optimistic, that generally in clinical trials you do better
Interesting. I need to check that. That's very interesting. Because for multiple sclerosis, at least what I can say is that stress is a risk factor for having a relapse. So for having one of these clinical bouts. So stress I would consider as mindset somewhat, right? Although you can only partly control that, of course. But still, like, stress plays into the disease definitely.
So as far as I know, I think there's no cure to MS yet. But if you had to bet on it, do you think that there will be ever a possibility to cure it?
Yeah, cure is a big word, of course. And I would say we are actually pretty close to curing it.
Okay.
Or at least for some affected people. And there is one very, very efficient therapy for multiple sclerosis, which is stem cell therapy. So you basically give a very strong chemotherapy to kill all the immune cells in an affected person with MS, and then you replenish the immune system again with a new you reboot the immune system afterwards, and you can be very lucky. And while killing the immune system, you kill all the autoreactive T cells. So the T cells which attack your own body parts, and these T cells are like the key reason why you have the disease. And so I would argue, if you kill this, if you could have a therapy which could selectively kill these T cells, you could potentially cure multiple sclerosis, or at least like in a population of patients.
But do you think that would make sense for the industry? Because, like you said, very young people like me or David as well are a group that is, that can get the disease, and we are really young. So if I would get the disease, I mean, I would have to take my whole life some medicine, and that is also a lot of money for the big industries. So, but if I could get cured, that would be really nice for me. But maybe for them, I don't know. Right?
Yeah. No, I agree, and it's an interesting debate. We could have probably an own podcast episode about that. Maybe for a future episode, talk to pharma about this. There's lots of so one of my main research interests is drug development, how drugs are developed from animals to humans, and eventually regulatory approval of these drugs. And yeah, I could talk hours about that, but what I can say now for this episode here is it would also be like a major coup for pharma industries that could claim, hey, look, we have a cure for multiple sclerosis. And this would probably outweigh the potential money loss in people not being dependent on a long-term therapy, right? Because that like publicity is so important for the pharma industry as well. Yeah.
And the possibility where you say you reboot the immune system, do you think that is a thing that you can do once and then you have it, or do you think that you have to reboot it maybe multiple times?
That's a good question. Usually you do stem cell therapy once because it comes, of course, like every therapy, with risks. And this stem cell therapy can potentially you can be like free from the disease afterwards, but it has major risks. You could potentially die because if your immune system is completely down, you're very, very prone to infections, like potentially deadly infections. And so this is something you have to be very careful about. Like doing this procedure several times would increase the risk even further for such complications. Yeah. But it's an interesting thought.
So what would happen if you didn't treat it at all? Multiple sclerosis. I asked myself when I wrote the script. I don't know what would happen.
Like not at all?
Yeah, not at all.
Very individually, I would say. So there is persons. It's like for many other diseases as well. There's persons who have a very benign disease course. They have a couple of relapses in 10 years or so. But there is people which have very aggressive disease courses and get worse very, very quickly. And so the answer is it depends highly on the individual disease course. But I mean, you cannot. Multiple sclerosis has been treatable since I think the late 80s or so, and beforehand there were no treatments available.
Yeah.
And there are still cases who, I mean, some people back then, they just died relatively soon from the disease, but some people just lived a relatively normal life with the disease.
How do you die of multiple sclerosis? Does your breathing system shuts down, or?
Yeah, I mean, nowadays, and this is important to know, nowadays multiple sclerosis doesn't really lead to a major decrease of your life expectancy, because nowadays you can treat it very, very well. Yeah. But potentially could decrease your longevity by the breathing system, for example, not being as efficient anymore, and then having an infection potentially and dying from the infection. But like multiple sclerosis, like rather dying from the complications of multiple sclerosis rather than MS itself. But again, today it's very rare that someone dies from multiple sclerosis or even the complications from multiple sclerosis.
You mentioned that your mother is also suffering from the disease. And so out of your personal experience, what advice would you give a person that comes with a new diagnosis of multiple sclerosis? What advice would you give them?
Yeah. So what I see commonly is young. I just recently had a young woman, seeing a young woman, and she got the diagnosis when she's now 21 or so, and she knows she will have this disease for the rest of her life. Like her whole family, and it's just a very difficult situation for them. Completely understandable. What I usually tell the people is it's fine to be angry about this. It's fine to be afraid. At the same time, I also think that you can also relax, because nowadays you can treat multiple sclerosis really, really well. There is more than a dozen therapies, approved therapies for the disease, which have some of them being very, very effective. I mean, it's still shit to have the disease, let's call it, but still, you can have much worse things in life, and you can treat it really well today. So I would also tell people, be angry, be frustrated, but also relax. It will be fine, likely. Yeah.
And what advice would you give the environment of the patient, like family and friends? I mean, they certainly are suffering too. Yeah. I mean, how was it for you personally also, if I can ask this question?
Of course, yeah. So, I mean, I was in med school back then, and I didn't have a big expertise in multiple sclerosis. So I was also afraid, of course. Although at first, I mean, my mother, she had a hemiparesis, so one side of her body was completely paralyzed. And I initially thought that she had a stroke or a brain tumor, which would have been much worse actually. So it was somewhat good news that it turned out to be multiple sclerosis. But still, I mean, she's an important person in my life, of course, and it was difficult for me as well. And I mean, my coping strategy was obviously to do a PhD and then trying to find new therapies. But like, what would I tell people? I think the same thing I would tell the patients, that it's shit, but you can treat it well, and you can be optimistic and about the future. Yeah.
Now, to end it on a happy note, what was the happiest moment in your career? I hope you have some.
I do have plenty of happy moments in my career, and I think for me, I mean, it was not, I wouldn't say it was a moment, it was one particular moment, but for me it was the process of learning about myself, what brings me joy, and what, like, embracing the concept of becoming a scientist, and really like following this career path, and accepting that science is what I want to do. Yeah. Also, I shaked once hands with Angela Merkel.
So, unfortunately, we are coming slowly to an end. We really hope we could provide you with some good insight about multiple sclerosis. If you have any questions, leave them down below. If you have any requested topics from the medical world, also leave them down below. We would really appreciate if you subscribe and like. Thank you for watching, and we wish you a healthy day.